Meanwhile, Alec McGuinness, I believe in the New Republic, heads to Tennessee to visit a clinic held by the Remote Area Medical. It's a Knoxville-based organization that basically goes into very poor parts of Tennessee and provides a free clinic for Tennesseans. 600 people basically spent the night in their cars lining up to get this free health care coverage. It was Remote Area Medical's 667th clinic. Basically, McGillis looks at this and sees that most of these people who will benefit from the Affordable Care Act, it will either A, allow them access to private insurance, B, allow them coverage under Medicare because it expands the, Medicaid, because it expands the threshold and where you're eligible for Medicaid. Or C, receive subsidies to purchase insurance on the private market. McGillis writes, despite spending tremendous political capital to pass the law, the party, speaking the Democrats, is unlikely to win many votes from the law's future beneficiaries, most of whom live in Republican-dominated states in the South and West. In fact, many at the clinic said they don't vote at all. Most of them had no idea about the law. In Tennessee, the program, Medicaid, covers poor children, pregnant women, and the disabled, as well as many parents below a set income threshold, which is $28,000 for a family of 4. But adults without children in their care are ineligible. Under the Affordable Care Act, Medicaid will expand in 2014 to cover anyone earning up to 138% of the poverty level, or about $31,000 a year for a family of 4. And like I said, people who who live above that income but lack employer-provided coverage will receive a sort of sliding scale of subsidies based on which income threshold they're at to pay for insurance. And then it goes on to talk about the potential impact of this law. A woman, 2 years ago, her son, then 16, was hit head-on by a speeding driver high on drugs. Her son's girlfriend was killed. The son suffered severe internal injuries and recently underwent colon surgery. Now at 18, he will soon age out of Medicaid coverage and will have no health insurance. His mother, 38 years old, recently lost coverage for her own personal coverage. She suffers from high blood pressure. She suffers from sciatica stemming from a work-related accident 8 years ago. She suffers from depression, has been on Prozac, but because her husband's disability payments went up, because he was caught in a front loader when he was 8 years old, can't work, she is now ineligible for Medicaid. So she has no insurance. Her husband's on disability. Her kid, also hurt, will no longer be eligible for Medicaid. All of this will be dealt with by the Affordable Care Act. In some states, such as Texas and Virginia, the threshold for Medicaid eligibility is so stringent that parents earning $10,000 a year are too well off to qualify. The Affordable Care Act will force states to raise their threshold and then fund it up to the tune of 95% for the first 3 or 4 years at the very least. And then essentially, McGillis talks to a series of other patients there, all of whom would benefit from the Affordable Care Act, few of whom are aware of it. And it's different stories. One 38-year-old had insurance through his job. Company changed hands a few years ago, sharply reduced the health benefits. He earns $40,000 a year. He couldn't afford the $6,200 per year health insurance. His 3 children are covered by Tennessee Care. So it would have been $6,000 plus a year just for him. He decided to forego health insurance. Then an injury that he had from, again, work-related, started to act up. He had to borrow $1,800 from the bank to get an MRI. He's experiencing constant stiffness in his hand because of his job as a painter using a spray can, a spray gun. He and his wife both have been suffering from staph infections. His wife just drains it by hand. Under the Affordable Care Act, Bailey could opt out of his employer's coverage if it costs more than 9.5% of his income, which it does now. In that case, he would receive subsidies to buy private coverage on his own. His employer would be assessed a $3,000 penalty. So the Affordable Care Act, as much as some of us on the left have had problems with it, and I think back to an interview I did with Chris Hayes over a year ago now, where he described the dilemma, analogizing the insurance industry as like the mafia, and the question of a store owner who is, do I pay off the mafia and make my business safe, but empower the mafia? Or do I not pay off the mafia, try and fight them, and suffer literally the slings and arrows of the mafia? And so, for what it's worth, the Affordable Care Act will help a lot of people. It will, of course, also maintain the private insurance industry, an industry which has a failed business model, is unsustainable on its own, and really serves no social utility whatsoever. It's a function that could easily be filled by the government. It works for 50 million Americans on Medicare. Medicare is far more efficient. It's also better at slowing the rate of increase of the care of healthcare, the cost of healthcare. And so a Medicare for all would be a far more effective solution. We're not there yet. And I can't say why. I don't know why. Well, I do know why. The power of the health insurance industry.